Hey everyone, it's Nancy the nurse practitioner and welcome to my next video. This one is on constipation. I'm taking you out in the backyard again because it's such a nice day in May in Connecticut where I live, and just wanted to bring you out in the backyard with me. Also, I'm wearing a baseball cap because we still can't get our hair cut, and I'm trying to find all ways I can do with my hair. So today I'm wearing braids, which I haven't done since I was like in 4th grade. Anyway, let's get right to it because there's a lot to talk about, and constipation is not fun, and it could be a serious problem, especially for the older person who's bedbound, they can't speak, and they can't tell you how they feel, and we need to be on top of knowing what to do and how to prevent it so that they don't have problems, or us for that matter, at any age. So these are the things we're going to go over today. What is the definition of constipation? What medications, diseases, and other disorders and factors can cause constipation? What are the risks from having constipation? How can we reduce the effects or problems of having constipation by doing certain things? And when do you see a healthcare provider or call them, or when do you seek medical attention immediately for constipation? So let's start out with what is the definition of constipation. Well, constipation is considered not having a bowel movement that are fewer than 2 a week. And I can't imagine not having less than 2 bowel movements a week, but some people go even longer, and that just means toxic waste still stuck in the body. If you're a good eater and you drink fluids, you should be having a bowel movement every day or every other day. But there's some things that cause people to not be able to have bowel movement every day, and one is sedentary situations like mom or dad who's just sitting around, they don't walk much. The other factors can be their medications. Medications such as Lasix, which is a diuretic, a water pill, kind of sucks the fluid out of the stool, and as the stool's coming down, it's hard as a rock and it can't come out. There's other medications called anticholinergics, which are used for bladder issues and like diazepam, and they can also cause constipation. Calcium channel blockers are another. Anti-inflammatory agents like Advil and Motrin, believe it or not, and drugs such as Tylenol with codeine, because it has codeine in it, and anything that is a analgesic such as that, like a narcotic, can actually cause constipation. Also some antacids that have aluminum products in them. So you got to look at the labels and make sure that you're not taking any medications that are going to make your constipation worse if you already have that problem. There's also some medical conditions that can cause constipation. Diabetes, believe it or not, is one of them, mainly because of the motility problems that can happen in the gut due to the vascular changes from diabetes and high blood sugars. Also Parkinson's disease, a neurological disorder, because neurologically our colon is innervated with all sorts of nerves that are supposed to help with motility as well. Stroke, another neurological disorder. Depression, dementia, and other illnesses that causes problem with salt and water metabolism can also cause you to have constipation just from having that condition. So those are things I definitely wanted to go over with you. Some of the risk factors from constipation is that if you sit on the toilet too long and you push and you push and you push, you can faint on your toilet and you could fall off the toilet. And I've had multiple patients have head injuries, break an arm or shoulder just from passing out and being found on the bathroom floor. So that could be a serious problem. Not to mention fissures, which are cracks in the rectal area and bleeding, which you'll just see tons of blood in the toilet gushing, and it's not very pleasant. And also internal or external hemorrhoids that also shows blood on your stool as it's coming out. So what can we do to reduce constipation? The first thing is you need to follow a bowel regimen, and a bowel regimen first involves definitely having a calendar on the wall in the bathroom. I love calendars where you put up the whole month and you can put, okay, mom had a bowel movement. It's 9 o'clock in the morning. It was a small one. And then the afternoon she had another small one. And then the evening she had a large one. You know she emptied out. But if you have small, then nothing for 4 days, you're getting a story and it's going to tell you where you're heading. And you could really prevent impaction or problems if you see the calendar changing and there's no stool record on the calendar. So put the calendar up in your bathroom with a pen or or something hanging to write a little note so you can record it the minute it happens. And any aide that comes in or any person taking care of your mom or dad or whatever should be marking on the calendar so you can keep up with that. Okay? Foods that will help to reduce constipation. Anything high in fiber. Okay, so what would be considered fiber? I love stewed prunes. You take 4 prunes, you put them in a little water, you put them in a pot of water, you stew them up, and they become potent. And if people would do that every day, throw it in their all bran with their oatmeal, which is high in fiber, they probably would stimulate and have a better chance of going. Coffee does it for a lot of people. But before we go into that, some other high fiber foods is bran. Okay, beans like lentils and navy beans, split pea, broccoli, sweet potatoes, and nuts. And also, most vegetables do have some degree of fiber. If you're going to eat an apple, eat it with the skin on, because the skin is where all the fiber is. So you don't want to peel the apple, and you don't want to bake the apple. Try to eat the apple with the skin if you can. It's kind of difficult for older people to do that because they don't want to chew it, but that is where the fiber is. Okay, another thing that's really important to mention is if you don't drink enough liquids. Older folks tend to not want to drink liquids. That means they have to get up to go to the bathroom, which actually is exercise, and they just don't want to do it. They just are tired and they just have no energy. Maybe they're on oxygen, whatever. But liquids are really important, and liquids do not mean they have to be water. Water is boring. You could have popsicles. You could have ice cream. You can have Jello. You can have anything that you sit in a bowl on a table that turns to liquid at room temperature is considered a liquid. And so mix it up a bit. Make sure you use things that could become liquid to make it more interesting. I love this. I make these really great smoothies, and I'm going to tell you more how I use them to kind of what should I say, trick my patients. But one thing that a lot of older people suffer from is not enough protein in their diet. And so if you can get a liquid in that has a lot of protein, a lot of fiber, it has some fruits and vegetables in it, and it has water, you've done a lot. And not only that, you can actually hide some things like Miralax in there. So this is what I use. I use this protein powder that's really high whey protein, and I could tell you where to get this. It's a wonderful product. I use 2 scoops of this with 8 ounces of water, a couple big scoops of raspberries, strawberries, blueberries that are frozen, and then some wheat germ, and you mix this up. And this could be going into the refrigerator for mom, and over the course of the next 2 meals or between meals, she can drink half of this. And what I would do if I feel like mom's not having enough bowel movements is I would add Miralax, which is this. You just sprinkle a little bit in, a capful and 8 ounces of liquid I could put in here now, and then mix it up. It doesn't sludge out and it doesn't taste like anything. And then you divide this up, and in the course of the day you make sure she gets it down and she can actually have a decent bowel movement with this. Some people also use Metamucil. You got to drink a lot of liquids. It's a bulk laxative, so it actually pulls the stool together to help you go. But if you don't drink enough liquids, I found that people do sometimes get constipated from this. Okay. Fleet's enemas. Enemas are cool and they're miraculous help, but if you have a large stool down in the rectum, that little spout from a Fleet's enema is not going to get beyond it, and it's going to just squirt out all over you. That's when you can actually get, and this is only if you really see that you're getting in trouble, and it's been like 4 days that mom hasn't had a bowel movement and she's starting to get uncomfortable. You're seeing that her belly is getting a little enlarged, that she's not feeling good, and she's probably telling you, I gotta go, but I can't. You can actually get a bucket, an enema bucket. They look like this. And they come with a tube, and they come with some jelly to put on the end of the tube. And maybe if you have a home health nurse or an aide, they can work with you on it. What's really cool about this bucket is you could use it over and over again. You could put a little castor oil in it, and you just push this tube into the rectum, which doesn't sound lovely, but that's what you do, and push it up a little way up to the black line here, and you would lift the bucket up. The higher you lift the bucket, the faster it would go in. So go slow, so it gets around the stool. Have a bedpan under the person, or have them on the, it's probably better on the bed, on the bedpan, or if they can do it on the toilet, but then it's hard to maneuver the tube, and watch the stool come out. And it would what happens is it goes above the stool, we'll push it down, and then she'll start to go, and then probably finish on her own. This is only necessary if you're in really serious situation and you need to go, because you don't want to go to the emergency room. They do not like to remove stool from the rectum, and I have done that, and it's not fun for anyone, but you'd have to actually help remove the stool from the bottom of the rectum, because there's a big bolus there, and somebody has to help remove and pull it down a little bit. So we talked about drinking plenty of fluids. That's big. Keeping a calendar is big. And another really, really neat thing to prevent problems is having a step stool. Let me show you this. It looks like this. One of these little step stools that fold up? You could put it next to the toilet, and then mom could pull it out and she could sit on it. And what it does is it actually allows her to put her feet on it, because if you think about it, when you squat, the pressure comes to the rectal area and the stool will have a better chance of coming down. When you're short and you're little and you're older and your feet are dangling and they're not on the floor, you don't have any leverage to remove the stool. So little step stool near the toilet is really a good idea. Okay, some medications besides the Miralax we talked about and the Enema is also Colace. Colace is a stool softener. It comes in a generic docusate sodium. You can get that at 100 milligrams. It's like 1 to 3 a day, and it will help to also keep the stool soft. But the real bottom line is it's just more medications for mom. So if you can do anything to entice her diet to be full of protein and fiber and liquids, she will go. And also just have her walk around the dining room table a few times if you can, because she should be exercising. This way it will also help her bowels to move better. The other thing we should go over is considering using hemorrhoidal cream. I mean, if you're noticing the blood in the toilet and mom's not complaining of pain much, but that it just is stinging a little, it might be just little internal hemorrhoids. So just get yourself some of this as an applicator. You push the tube, you stick it up the rectum, and a couple times the next few days just to clear this up. Okay? Probiotics is massive. It helps the gut, and I could talk to you more about that as well. If you have any questions about the probiotics or protein, you can always email me at Nancy, the NP. The NP means THE, NP for nurse practitioner, at gmail.com, and I will be glad to share some information with you about them. The other thing we should go over as well is if it's diarrhea versus constipation. This is a serious problem. Sometimes if you're looking at your calendar and you're seeing no bowel movement Monday, Tuesday, Wednesday, Thursday, and now all of a sudden there's liquid stool, I get really nervous that what's happening is there's stool in there, but what's happening is it's caused a blockage, sort of, and the liquid above it is coming down around the rectum and leaking out. And what that means is that the person's becoming impacted with stool, and that it needs to get that big bolus or big chunk out first. So I would go visit my patients. I would do a rectal exam when I'd see this. If I feel a big chunk of stool, I'd have to help her digitally by removing it myself. Might give her an enema. Sometimes you can also give milk of magnesia, 2 tablespoons at night, and then a Dulcolax suppository at the same time. And the milk of magnesia pushes it down, and the Dulcolax suppository stimulates from below, and it will come out. But you don't do that unless it's been a few days. And if she's got liquidy stool, you're beyond that. So if I'm worried about the person getting an enema, I may have to get a flat plate x-ray of her belly just to make sure that there's not stool all the way up and that she has distended bowel, because that can mean that I would have to do something bigger like citrate of magnesia, a whole bottle of that, which you take before you go to have your colonoscopy to really flush out. But that's a lot for an older person to deal with. So don't get into that position where you have to do all those things, because it's hard on an older person. It reduces their electrolytes. It can make them more dehydrated. It wipes them out for days. And it's also hard on the heart, for them. So a couple other things we should just go over is then what we should do is when you should see your healthcare provider. So if you're having abdominal pain or fever and you're not going, then that's a reason to call your health provider right away. If you have leaky stool, which is leaking out, or if you have recurrent bleeding from the rectum, which is just not stopping, that's important then too. Watery stool with no bowel movement for 5 days, we talked about that as possible impaction. Now, when should you seek immediate care? If the stool is black, black like black, and it's tarry, you can't get it off the tissue, you can't get it off. That means something called melena, which is black stool, and that means there's some kind of bleed going on up in the GI tract. Vomiting yellow or green stuff is not good. It can mean some GI problems as well. Oh, here comes my kitty cat. And then vomiting with unusual abdominal swelling could also be serious medical problems, and those you need to seek immediate attention. Get your history together, know what the bowel patterns have been, when did the fever start, when did the stomach pain start, and then you can actually decide from there what you're going to do. But don't worry, always call your healthcare provider. Just because we're in a COVID situation, you need to address that. All right? I just thought you might like to meet my little kitty cat. Here's Onyx. He's a big boy. Yeah, say hi. Anyway, so from Nancy, the nurse practitioner here about constipation, I hope this gives you information you can use to stay out of the hospital, reduce some emergency problems for something very common that we can solve. Well, a couple more things that I forgot to tell you is avoid processed foods, like donuts, white bread, pastries, fast foods. They have no fiber in them and they have no nutritional value. And don't hold your stool. If you gotta go, you better find a bathroom and go, okay? All right, for now, from Nancy the nurse practitioner, take care, and see you at the next video at YouTube at Caregiver Success. Thank you. Bye-bye.